Thank you, and I think everybody in the room is very glad to have this new big kid on the block, because agriculture has certainly been underplayed, and we assumed that the issues were over. You haven't convinced me in that you're bringing a lot of players that come from different parts of the puzzle. How are you going to aggregate these? Because you're working in real live countries, you're not working in the United States. Talk about how you're going to aggregate these into real initiatives that'll make a difference. For example, in countries that absolutely ignore the nutritional needs of women and children, countries where women are fed third, if there's enough food left over, countries that don't get adequate maternal care for mothers and think that a mother that can't provide for herself during the lactation and the pregnancy time is not proving her value as a woman. There's some very real issues out there. How is bringing all this very real expertise, how is it putting it together going to make a difference?
Well, I think one of the key elements to this initiative, and if we do it right, we're going to be a little hard-nosed about it, this is a country-led initiative. And we can't want this more than the host country does itself. If the host country is not willing to take the tough decisions to promote agriculture, to put money into agriculture, to provide an enabling environment for agricultural development, well, then we're not going to focus on that country. And we've identified about 20 countries that we're looking at right now that have made strides and have, in Africa in particular, worked through the CADEP process, have done compacts and have those agreed to and have met the criteria for those compacts. In the cases where you mentioned where there are large, needy populations, we still have our humanitarian assistance programs, which will continue to meet those kinds of needs. But this, at its core, is an economic development program, and if there's not a commitment by the government, we'll go work someplace else where there is, because we have more money, but we don't have that much money.
Naminga Ngongo, what do you do? This can be called culture, or this can be called a major impediment to actually solving the real nutritional and health needs that are related to agriculture. What do you do about these? How do you convince? How do you persuade?
Fortunately, the pressure from prices are putting pressures on government to be able to take the decisions that are required to prioritize agriculture. I would say that in Africa, you can see that most African governments today are stepping up their contributions to agriculture. Not yet enough. Maybe only 7 to 10 countries have crossed the 10% threshold that they set, but the trend is on the right direction. So, but also we are getting better organizations also at grassroots levels. Farmers organizations, the community-based organizations are getting better organized and getting the skills that are required to be able to engage in the processes that are being supported by this Feed the Future. So that I'm not speaking for CADAP, NEPAD, but clearly they are playing a much more of a coordination role in most of the countries, of which 22 or 25 have actually signed the compacts. So clearly there's a much more of a movement in taking advantage for such initiatives like Feed the Future or any other increases of like the World Bank Trust Fund or the other financial mechanisms that have been put into place after the L'Aquila conference. So I'm sure that the whole community is moving, at least in Africa, moving in the right direction. Not fast enough to satisfy everybody, but I think positively so. So we welcome the Feed the Future initiative, and we hope that the country-led approach will bring about even a better buy-in.
Okay, William, a quick segue to you, and then I'm going to give Derek his 5 minutes to pick up on the value chain reference that you make and anything else that he wants to do.
Just a quick comment, and I think if you go back about 15 or 20 years or further back than that, there's been a call by donor governments for countries in Africa to step up and take responsibility. I think we're seeing that in a big way right now through this CADEP process and what has happened in a number of countries who are in fact stepping up and taking responsibility for this. And then the other side of this applies to the donor government. If the African countries are willing to step up, the donor governments have to guarantee a sustained commitment to this initiative too to make it work. We have to do our side of the bargain. The African countries I'm seeing are starting to step up and do theirs.
It's a song Carlos would like to sing too. Derek, yes, no, Derek.
Yes, I think listening to this, I think it's, let me try and give a couple of different perspectives and open the debate even a bit further. I think while the emphasis has been on understanding that the smallholder farmer and her family are at the core of the debate, if we don't actually look at the broader forces at work, we will not achieve the desired improvements in reducing hunger for her at a community level. And I think that goes back to the question that was asked by one of the earlier people, who needs to be at the Sylvia Burrell, who needs to be at the conversation? So let me just give some thoughts about who I would have at the conversation, also based on ideas that our CEO, Indra Nooyi, put out at the World Food Prize and try and expand it. Clearly, we need the worlds of Norman Borlaug and his followers, which includes many of you in this room. The traditional people coming out of agriculture who understand, like nobody else, the depths of agricultural science, its needs, the role of smallholder farmers. That is a taken. We added in David Morley. For many, David Morley will be unknown in this room. He was the father of focusing on science-based approaches to undernutrition in Nigeria, started growth monitoring. He focused on the nutrition questions. And our concern was that while Norman Borlaug and David Morley had careers that changed agriculture and nutrition, they never met and thought about how they could integrate their work. The third person I'd have in the room, who may even be in the room, is Srinath Reddy, who's one of our global leaders in chronic diseases and cardiovascular disease and diabetes. And I have no doubt he would remind us that that is the biggest cause of death, disease, and ill health in the world, and that the consumption trends that drive cardiovascular disease and diabetes severely distort the availability of grain and the food supply that has direct implications for attaining food security. Without having that debate integrated into the debate around undernutrition and food security, we simply can't make progress since this is a world with finite resources. I would also take my previous boss, Gro Harlem Brundtland, and put in the room, not in a role as WHO head, but as the chair of the Commission on Sustainable Development so many years ago, when she highlighted the critical need to say that while health needs to be at the center of our concerns about sustainable development, that is unattainable without addressing the realities of water scarcity, greenhouse gas emissions, and of course, both of those are directly related to the decisions made in what gets grown, where it gets grown, how it gets grown, and how it gets transported and processed. That debate also needs to be inside the room. And I would end off by having Professor Swaminathan sitting in the room to be the chair, bringing in a science-based approach to do the toughest thing of all, which is to recognize that there'll be conflicts between interests. There will always be a conflict between driving a policy to address undernutrition and the continued demands of the consuming population in the emerging economies of the world. There'll be constraints on how we can actually limit the negative impacts on the environment and think of agricultural policies that enhance those approaches. So I would say that the most important question before we even start moving is to think about, do we have the diversity of views, perspectives that are able to help us answer the key thesis of this extraordinarily important conference relating to how we can make sure that agriculture does in fact lead to improved nutrition across the entire nutrition spectrum, from under to over to optimal nutrition.
Take us through, please, how the concept of working at various points in the value chain on a product could actually attack some of the non-communication and some of the issues that we're talking about in trying to get a better health and nutrition impact.
Well, at the start of the value chain, the decision on what gets grown is a fundamental decision. A decision to have a diversified diet means, which we've heard earlier, would be a greater assurance for long-term health and nutrition status than focusing on a limited number of staples is pretty critical. The private sector's role in doing that can be critical by recognizing that It wants to grow fruit, vegetables, grains, nuts, legumes, and it needs to be working with the public sector and use the capabilities of public sector research to stimulate a diverse vision of the world as opposed to an increasingly reduced diversity. I think we bring enormous strength, particularly, as I mentioned earlier, in the area of recognizing that the world will not be fed purely through fresh fruits, vegetables, nuts, and whole grains, and that some degree of processing will occur that have many beneficial effects. It reduces, as I said, the post-harvest losses. It adds value to the product, both bringing income to the country as well as to the community and the farmer. Further along the value chain, clearly the issues around marketing, modern forms of marketing remain critically important to help shift what is regarded often as a limited perspective on the optimal diet to actually have a strong force of marketing that addresses the diversity that we want in the diet. And finally, I'd say the one issue that strikes me as a huge opportunity for a private-public alliance to be strengthened is around capacity. Capacity in a new vision of agriculture, plant, and nutrition science that has a more integrative approach to build the needed cadre of individuals and institutions in emerging markets. And in looking at that, I put on my hat as primarily coming from the health sector and look at the NIH's Fogarty Center, which has played a major role in stimulating institutional and human capacity in the field of health, whether it's infectious diseases, AIDS, increasingly chronic diseases. And I wonder what is the equivalent of the Fogarty Center for Agriculture in the world, where there are significant investments available for developing country institutions to start growing the cadre of future scientists needed, both for the science, but perhaps even more importantly, to have the kind of policies that will allow the vision to become a reality for farmers.
Anybody want to comment?
Yes, I would like to make a comment on the CGIAR reform process that we're undertaking at the moment. And I think the thing I would like to say is that for a process of reform of this kind, it requires responsibilities and obligations on both sides, on the side of centers as well as on the side of donors. On the side of centers, international agricultural research, as you all know, is a long-term undertaking. It requires planning, it requires the centers to bring the collective actions, to devise the programs, to recruit the scientists, to coordinate their actions and to put a management structure. On the side of the donors, we cannot just live with long-term commitments of good faith. We do need, in order to bring this to a successful fruition, we need the stability and the sustainability of financing that will give the assurances to the donors that we are on the same road. The reform process is a two-way process, as I was saying, and I think that we need much more, as I mentioned, than commitments. We need sustainability and reliability of financing, at least in the medium term, in order to be able to carry out that reform.
Okay, well, we're getting to the point where somebody's going to start ringing bells at us. But we were asked to end with 3 minutes, coming up with a conclusion. So I'm going to tell you what I got as possibly the principal conclusions, and then pass the microphone right on down and ask you to amend these and to say, we've forgotten this or we need to put this in. So what did I hear coming out of each and all of you together as being the most important parts to start this transformation, because we're looking at how to transform what we do now into something that will have a larger health and nutritional impact from agriculture. So I took about 5 points. Number one, that research has to be on the range of diverse foods. That second, the particular needs of women and children really have to be front and center in terms of the diverse foods. You can't, third, forget about increasing production. And the attention on the production program really has to be focused at the farmer, the small farmer level, to solve both the agricultural and the nutritional issue. Fourth, the whole armamentarium, the whole of government as it was referred to, needs to be brought to bear on this. All of the skills that have been described have to be brought to bear. And when you brought these to bear, recognize that diversity of views have to be managed. So it's not just enough to bring the voices, you have to manage them. A value chain can be important. I'm still not as clear as I wish I were on how. But I like the comments, you can't want this more than the country. That we need to, at the same time, work together to try and find these answers, but also continue the pressure to try and create the kind of partners that want these goals as much as the institutions that are represented at this table. So those were the conclusions that I drew from what you gentlemen put forward on the tables. Let me just pass this down and ask you for your concluding thoughts, whether that just about captures it or what you would add to that.
Start from that end.
We're going to start with that. Derek, we're starting with you.
Well, Margaret, that was excellent. My only add would be to really look carefully at the title of the conference again and see that it ends with the word nutrition and health. It doesn't end with undernutrition. It doesn't end with food security. And I know that there's a deliberate intent of the meeting to keep the breadth of thinking. So I would hope that during the course of the meeting there are many sessions that could be used to prepare for the UN high-level meeting in September, where the issue of chronic diseases will be on the table. And my wish is that the intimate links between our discussion, the role of agriculture and nutrition, would play out in two very specific ways. One is to draw the link between undernutrition and early childhood factors and the long-term implications for chronic diseases. And secondly, to look at the structural implications of increased consumption trends across meat and a whole range of products driving cardiovascular disease, and what that means down into the availability of grain and the food supply that long-term will be needed to address the needs of the very poor.
I would just add a little bit to your excellent summary, that a lot of what we are talking about will require investments. And Carlos and both Bill, they talked about financing and long-term. But maybe we need to mention also the need to have innovative ways of raising financial resources from the private sector to engage in many of the investments that will be required to improve production, nutrition, and health in most of the countries, especially in Africa. Yeah.
Thank you.
And I don't have a whole lot to add. I think you covered it. One thing to just to mention, in that to really support smallholder farmers and particularly women farmers, there has to be great attention to associations and cooperatives, and to working through those to be able to more effectively market, store, and deal with your produce. And then the last comment, again, is it's very important for all of us to support host country leadership. They have tough decisions to make in this process, and it's not easy. It's easy for us to talk about it. It's really hard to do it. So we have to be very supportive of those leaders who take this very seriously and engage with it.
Just a final word. I have nothing to add to what you summarized, but I'd like to send perhaps a final message, which I think is important. And the message is the following: although World Food Security, it's considering the G20, G8, and all the ministerial and high-level declarations at the same level as other problems like financial crisis or climate change, for example. When it comes to the response, I feel that the food security and nutrition do not get the high political profile, who do not figure in the priorities agendas of governments as they should. And therefore, you see that it is easier to find solutions and to fund trillions of billions of dollars to fund a financial crisis overnight, or to address problems of climate change, much easier to address these issues than to address issues of food security and malnutrition, which nevertheless kill much more people than the other things. And therefore, my plea would be that rather than looking at these issues as humanitarian issues, I think that we should elevate issues like world food security and poverty alleviation and malnutrition as high political issues.
Well, if I were going to add one wish for myself, it would be that we agree as a community that there might be a priority among all these priorities. My personal wish for the priority would be that we really concentrate on the first 2 years of a child's life. When you look at the mental and physical impact of low birth weight and of undernourished children, a campaign around 700 days to build a better child that would be global, and you can't feed a child better without feeding the mother better, so that's hidden in there. But why not agree that 700 days per child would be something the whole globe might really take on, doing it differently? So there you have conclusion of debate. You have another wish list thrown in, and now your task is to thank this panel very much. Thank you.